PACE Gonioscopy Lecture, Part 1. Today's discussion is an introduction to the clinical technique gonioscopy. To start, it's important to know what this procedure is for. The gonioscope is used to view angle structures that you wouldn't ordinarily see using a slit lamp because of total internal reflection by the cornea. In order to see into the angle, we need to neutralize the cornea with a contact lens, which allows you to see the angle structures. When would you do this procedure? The primary reason would be to further investigate narrow angles as judged by your Van Herk slit lamp technique. For example, if you observe less than a grade 2 Van Herk angle, which using a ratio would be less than 1 to 1/4, we would consider doing gonioscopy to have a good look into the angle to make sure everything is open. In patients who have had trauma to the eyes, particularly blunt trauma, there may be damage to the iris root causing an angle recession, and you will need to look at the angle with the gonioscope in order to determine that. More commonly, gonioscopy is performed on patients who have risk factors for glaucoma, such as pseudoexfoliation, pigment dispersion syndrome, neovascularization of the iris, and so forth. When should you not do gonioscopy? Certainly, in any case where you suspect there might be a penetrating injury to the eye, you don't want to put pressure on that eye and force aqueous out of the eye, reducing the pressure, causing secondary complications. If the patient has received a facial injury and may have suffered an orbital fracture, you don't want to press on the eye and damage things further. Patients with hyphema, that's blood in the anterior chamber, are at risk of a recurrence, so you don't want to put any further pressure on that eye in case you cause more bleeding. Also, in cases of severe corneal compromise, and they would have to be quite severe before you would really worry too much, you do not want to put a contact lens on the eye. There are several different kinds of gonioscopes. The one that we tend to use most often is the Goldmann 3 mirror. That's the lens we will start with. There are other types of lenses, such as the Posner or Zeiss 4 mirror, or the Sussman, which is a version of the 4 mirror that doesn't have the handle to hold it with. We're going to concentrate primarily on the Goldmann 3 mirror as an introductory lens. The Goldmann 3 mirror is a contact lens. It has 3 different mirrors in it, one of which is designed for use with the angle and peripheral retina, and that's the one we're going to pay attention to today. The other 2 mirrors and the central lens are used for fundus examination with a fully dilated pupil, so we're not going to address those ones in this session, just the gonio mirror. It's the small mirror that's sometimes referred to as the thumbnail mirror because it's curved like a thumbnail. The other 2 mirrors are more rectangular in shape, and they're the ones that are used for the fundus exam. Each of the mirrors will angle the view to different parts of the internal structures of the eye. The mirror we are looking at will view the angle and the peripheral retina if the pupil is dilated. As mentioned, the 3-mirror lens, the Goldmann lens, is a contact lens. It rests on the sclera, so it vaults over the cornea. It's used with the slit lamp, which allows for a full range of magnification and illumination levels, as well as binocular viewing. The Goldmann lens makes contact with the eye. Therefore, it must be disinfected before use. The Center for Disease Control has approved 3 methods for disinfection. One is a 10-minute soak in 70% isopropyl alcohol, which is quite effective, but unfortunately the alcohol will cloud the plastic of the lens over time, so it shouldn't be used because it will damage the lens. The second method is a 10-minute soak in 10% bleach solution. This is very inconvenient because you have to take regular bleach, dilute it 10 to 1, and deal with the solutions and so forth. So that's not very frequently used. So what we do is use a 10-minute soak in 3% hydrogen peroxide. It's the same peroxide that is used for disinfecting contact lenses, so it's really easy to come by, and it does a very good job of keeping the lens disinfected. The lenses don't have to be sterile, it's not a surgical procedure, but they do have to be disinfected. It's an aseptic procedure. So the first thing we want to do is rinse the lens to remove any debris that might have accumulated on it from previous use. Then soak the contact surface in peroxide for 10 minutes. and then rinse the peroxide off the lens using sterile saline. Then we'll dry the lens with a clean tissue so that it's easier to handle. After you've used the lens, you want to clean it with a liquid soap. Rinse it, and you can rinse it under the tap at this point. It doesn't have to be sterile saline. Dry the lens, and put it back in its storage case until its next use. Because the lens vaults the cornea, it will leave a space in between the cornea and the lens, so we need to fill that space with a solution. There are a number of products that are available that are made specifically for that purpose. They have trade names like Goniosol or Gonioscopic. What they do is provide a nice optical continuity between the lens and the cornea. The solutions are very viscous, so they're easy to handle. When you put the solution in the lens, it won't spill out of the concave surface of the lens when you tip it. Most of these products contain preservatives, which is somewhat irritating to the corneal epithelium. In laboratory use, for prolonged contact with the eye, we use unpreserved CELAO, so it really doesn't pose any problems that way. Clinically, many people prefer to use the trademark solutions because they're a little more viscous and a little easier to handle. In clinical practice, the lens is usually not on the eye for very long, but in the lab setting, where we're practicing, we use CELAO.